Good afternoon. I'm Madison Knight. Today I'm going to educate you about a chromosomal disorder, also known as Turner syndrome, that about 1 in every 2,500 girls are born with. Turner syndrome is a chromosomal defect that is only in girls who are missing the second X chromosome for growth, puberty, and reproduction. 98% of girls who are diagnosed in the uterus with this disorder do not survive to birth. Even though only about 2% of girls with Turner syndrome survive to birth, this is still a very important disorder that we should all know about. As a person who has a friend with Turner syndrome, I've seen firsthand some of the issues that are caused by this disorder. Many of you know about the signs, symptoms, and causes of Turner syndrome, but not many know about other complications a girl with this disorder faces, such as a learning disability, puberty problems, and growth problems. The first complication I'm going to share with you is nonverbal learning disability. Dr. Dean Mooney states that research has shown that a very high percentage of girls diagnosed with Turner syndrome exhibit the strengths and weaknesses seen in individuals diagnosed with a nonverbal learning disorder. A nonverbal learning disorder is a number of cognitive strengths and challenges that impacts a child's success in academic and social settings. Dr. Mooney believes the ability to verbalize ideas is the primary strength of a student with a nonverbal learning disability. The difficulty occurs when the student is asked to translate these verbal ideas into a written product. Either the student feels overwhelmed by the idea circulating in his or her head and cannot begin the task, or they start immediately and are left with a jumble of ideas and have little progression. Girls with Turner syndrome that have the nonverbal learning disability also have a very hard time socializing with others. They tend to talk a lot, but they do not talk in the most sociable way. They find it difficult to start a conversation and to keep conversation going. One reason girls with Turner syndrome have high anxiety and depression is because of their nonverbal learning disability. The second complication I'm going to share with you is growth hormone therapy. Most girls with Turner syndrome take growth hormone therapy. The purpose of this therapy is to help girls with Turner syndrome grow to a height that will not consider them handicapped. Without this therapy, the average height of an adult woman with Turner syndrome is 4 feet and 8 inches. Girls with Turner syndrome who do not receive growth hormone therapy are usually about 8 inches shorter than their predicted height would be with growth hormone therapy. If treatment starts early and is maintained, it is possible for these girls to reach normal height. When bone growth is at its full capacity, growth hormone therapy has to be stopped because it can be very harmful if it isn't. The third complication I'm going to share with you is estrogen replacement therapy. Dr. Daniel Toft and Kelly Rayan state in a different article that estrogen replacement therapy, which can be taken by pill or patch, does two things for girls with Turner syndrome. It prompts the body into beginning puberty and to maintain healthy sexual development and functioning throughout adulthood. Early ovarian insufficiency is common in girls with Turner syndrome. Estrogen replacement therapy effectively replaces sex hormones if the body cannot make them itself. Another reason girls with Turner syndrome have to take estrogen is to provide calcium for their body. Dr. Toft and Rayan state that estrogen therapy takes place when growth hormone therapy is over. Most girls without Turner syndrome have their first menstrual period between the ages of 11 and 14 years old. So many girls with Turner syndrome who have not started puberty choose to start estrogen treatments around that age. When girls start this treatment, they have to start out with a small dosage and slowly increase the dose over several months. Once a girl starts estrogen replacement therapy, she will continue it throughout her adult life until she reaches the age of menopause. Dr. Toft and Rayan also expressed that girls with Turner syndrome experience a lot of unusual physical characteristics related to sexual development, such as lack of breast development, undeveloped feminine curves, and delayed or non-existent menstruation. Estrogen replacement therapy helps correct those physical abnormalities and can improve psychological well-being and self-esteem. After hearing me talk about a nonverbal learning disability, growth hormone therapy, and estrogen replacement therapy, I hope you understand a little more about these complications girls with Turner syndrome face. Have you ever met a girl with Turner syndrome and wondered how she is different from a normal girl? Or what complications she faces because of this disorder? If so, I hope this has helped you understand more about her and the complications she has to face every day. In conclusion, Turner syndrome is a chromosomal disorder that a very few girls are born with.